Welcome to Cancer Explained. My name is Dr Philippa Kaye and I'm here today with Dr Matt Fittall, a prostate cancer oncologist, to talk about how prostate cancer is treated stage by stage. Today we're going to guide you through the most common symptoms to look out for and learn how people get diagnosed and what treatment they might have. Dr Matt, welcome. Tell us a little bit about yourself.
So I'm a clinical oncologist, which means I'm a specialist doctor specialising in the treatment of prostate cancer.
Let's start at the beginning. What exactly is prostate cancer?
Well, cancer is a disease where normal cells of the body grow abnormally and form a tumour. So prostate cancers start in the prostate, and the prostate is an organ which sits just beneath the bladder and just in front of the rectum.
Now, who's at risk of prostate cancer?
Well, anyone with a prostate is at risk of prostate cancer. So that's men, trans women, and anyone assigned male at birth. Black men are diagnosed with prostate cancer more commonly.
But why might that be?
Well, we're not exactly sure. It may be related to inherited or genetic factors. Up to 1 in 4 black men will be diagnosed with prostate cancer in their lifetime.
What are the main symptoms of prostate cancer?
Well, prostate cancer often has no symptoms, and many men who have symptoms don't have prostate cancer. But the symptoms people most commonly report relate to how they pee. So that's often men might pee more frequently, with more urgency. They might sometimes find the stream changes, or they don't feel like they pee completely. More rarely, we see that men sometimes report blood either in their ejaculate or in their urine, and occasionally report pain either when peeing or when ejaculating and producing semen.
What tests are done to diagnose prostate cancer?
So the first test that most men have as part of the pathway is a blood test to test for a protein called PSA.
What's that?
So it's a protein which can be produced by normal cells in the prostate, but prostate cancers produce more of it. So when it's elevated, that may be a sign that you have prostate cancer. So if that is the case, you'll normally be referred to the hospital to have further tests. And the first test you usually have is an MRI, which is a very detailed scan of the prostate, which has a good ability to find if there is anything abnormal that might need more tests in itself.
Now, I think that you've not mentioned a test that some people are worried about.
So you're talking about the rectal examination, which is an examination of the prostate using a gloved finger to feel for any lumps or bumps or abnormalities. But most often that's not actually needed. And it's only needed in rare cases if there's something which doesn't fit with the blood test. If the MRI does show some abnormality in the prostate, normally we'll go on to do a biopsy, which is a sample of cells taken from within the prostate itself. When that is done, an ultrasound will be needed to guide that, and that's put into the rectum. But many men will never need an examination like that as part of a process. Having said, if the MRI does find any lumps that need further tests or a biopsy, they may then need an ultrasound.
Sorry, what's a biopsy?
So a biopsy is when a sample of cells is taken from the area to confirm whether there is cancer.
And if cancer is diagnosed, what might happen next?
Well, the next thing is that some men, but not all, will need further tests or scans to identify where the prostate cancer is. But once all that information is complete, you'll have a discussion with the doctors looking after you about what treatment is necessary.
And what are the different stages of prostate cancer?
Well, prostate cancer is staged and classified in many different ways around the world. The simplest way to consider it is whether it's early, locally advanced, or advanced. But actually, most prostate cancer is diagnosed when it's still contained or nearby the prostate itself. And in that case, there are systems which we use based on the PSA and the cells taken to understand what the risk might be and what treatment.
So let's take a look. If we look at the prostate here, where would an early stage cancer be?
So most prostate cancers sit just within the prostate itself, and an early prostate cancer is still found within the capsule or the surface around it.
And then a locally advanced prostate cancer?
Well, locally advanced prostate cancers can grow in two different ways. They can either grow through the capsule or to the seminal vesicle next door, or the next thing they can do is start to spread to lymph nodes locally and nearby the prostate.
What exactly are lymph nodes?
So if we look at this front-on view, with the same thing we saw before with the prostate and the blue spot is a locally advanced tumour. So lymph nodes are a normal part of your immune system, which prostate cancer cells can first spread to on the way potentially to other parts of the body.
And what about advanced cancer?
So advanced cancer is when the prostate cancer is spread beyond those areas. So it might have either spread to some lymph nodes in more distant parts, so higher up in the body, in the back part of the tummy, or to bones anywhere else in the body.
Thanks, Dr. Matt. Now, earlier I spoke with Paul about his experience with prostate cancer. Tell us a little bit about what your life was like before you had your diagnosis.
Before my diagnosis, spending lots of time with family and friends. I used to coach boxing 3-4 times a week. I was really interested in that. I used to work with children and young people that were often involved in criminality, and that was something I was very passionate about.
What were those first sort of signs? What that first inkling that something might be going on?
There wasn't any signs, there wasn't any symptoms, there wasn't any inkling. I saw an advert on telly when I was 40 years old, and it spoke about a men's MOT. Go to the GP and they check you from head to toe. And when I went to the GP, they said to me, "What's wrong with you?" And I was like, externally, nothing is wrong, but internally, I don't know. And then they said to me, well, if nothing's wrong, we're not going to give you the test. I had to be assertive. I had to stand my ground. And we had a bit of back and forth, and I had to raise my voice. So eventually, I was able to get the test, and I continued to get the test.
By that, you mean a regular PSA blood test?
A regular PSA blood test, and they kept on asking me, do I have difficulties urinating? Do I have difficulties with the flow? All of these questions around urinating and et cetera, et cetera. And I was like, no. But every 3 months, I had to keep going back for tests. The GP kept on saying nothing was wrong, but yet I continually had to go for tests. And then one day he spoke about giving me the DRE.
And what did he explain?
My prostate is around my rectum, and then they can put their fingers in and feel it to ascertain if it's enlarged. So again, I was very uncomfortable. Being a man from the Africa or Caribbean culture, that wasn't something that I wanted to go through. But again, and I think at that time I was putting my masculinity ahead of my health. But I pulled on my big boy's pants, and I went through it, and I had it. And again, that was inconclusive. They still wasn't sure whether my prostate was enlarged, but there was no signs that it was cancerous at that time.
How did you receive your diagnosis?
I was sitting in the hospital, and the oncologist came in. He looked at my notes. He looked at me. He looked at my notes. Looked at me, and then he was like, "Oh my God, oh my God, oh my God." He got up and he hugged me. And then he sat back down, and at that time he hadn't said, "Yeah, you've been diagnosed with prostate cancer," and then he said it after. But I think for me at that time, because of the amount of appointments I had, because I was going to 3 different NHS trust hospitals, I'd self-diagnosed myself already. Yeah. So when he said it to me and when he behaved in that horrendous manner, I wasn't. It didn't throw me because I'd already kind of diagnosed myself, but this whole process, and that was the icing on the cake, as well as finds out that I have prostate cancer.
So what are the treatment options for prostate cancer?
Well, the treatment options will be discussed between you and your doctors, and we're based on information about the cancer, its stage and its grade, but also your general health and your preferences. And some prostate cancers may not need treatment at all.
Hang on. You're telling somebody might not actually need treatment for prostate cancer?
Well, some prostate cancers are so slow growing or barely grow at all that they can be very closely monitored by your doctors.
So we are doing something?
Absolutely. They'll have very close monitoring with blood tests and also additional scans to see if there's been any change. And if there is change, then treatment can be offered at a later point. But that means you can essentially have none of the side effects that you might otherwise get with treatment.
Now, if you do need treatment, what might that be?
Well, there are 3 main treatments for early and locally advanced prostate cancer. Usually that involves either an operation to remove the prostate, called a prostatectomy, or radiotherapy to treat the cancer where it is in the prostate. Sometimes that's given with the 3rd treatment, which is hormone treatment.
What does surgery involve?
Surgery is essentially an operation to remove the prostate itself. So So it sits down in the space between the bladder and the rectum, and the surgeon will remove that entirely. It's usually an operation where a patient will need to come into a hospital and stay overnight because it is a big operation and does need some cuts in the tummy to carry it out.
Often by a robot these days.
Yes, indeed. Around the country, it's now often done in big centres where they carry out lots of these operations every year, but it's still a surgeon carrying it out.
What exactly is radiotherapy?
Well, radiotherapy is a very common cancer treatment where we use high-energy X-rays to destroy cancer cells.
And here we've got some nice healthy cells and some prostate cancer cells. So how does radiotherapy work?
Radiotherapy is a highly focused and highly targeted treatment, and we usually use beams of radiotherapy from outside the body that focus on where the prostate cancer itself is. So if it's within the prostate, we deliberately try to spare the tissues around it, so the bladder above it and the rectum behind. So that would effectively kill the cancer cells within the prostate.
And what about that nice healthy cell that's still in the way?
So there are some normal cells that form within the prostate itself. For example, the tube that takes the urine out from the bladder goes straight through the prostate. So some of these will be affected by the radiotherapy, but generally they recover again in the long term.
Now we also have hormone therapy. How does that work?
Well, prostate cancers depend and rely on testosterone, which is a sex hormone, to grow. So we have ways of targeting that and preventing their growth. There are two main ways for that. One is we can prevent the production of that testosterone, or alternatively, we can actually prevent how it acts in the cancer cells themselves. The most common ways that's given is either by a tablet or an injection.
Now earlier we talked about locally advanced but also advanced prostate cancer. What are the treatment options for advanced prostate cancer?
So the cornerstone of treatment for advanced prostate cancer is hormone therapy, and patients will usually have hormone therapy long term. We often combine those two different ways of giving hormone therapy, and there are many other treatments as well becoming available for men with prostate cancer.
What are some of the common side effects of treatment?
Well, side effects, I guess, can be split up into two different ways. You can either look at the local side effects from the local treatments like surgery or radiotherapy, which normally affect either the urinary function, so how someone pees, so it can affect their continence or how frequently they might need to pee, or alternatively, the more widespread body side effects of treatment. And particularly with hormone therapy, those are more common. And those can involve either the shape and pattern of the body and fat and muscle that is there, or their mood type side effects from hormone treatments.
And what about something which people less frequently talk about, things like sex life?
So again, either local treatments and also the hormone treatments can affect the sexual function, because either they affect the nerves that supply the penis or the hormones that drive that normal function. So that can be impacted by treatment. But whatever side effects you might experience, you can discuss those with your doctor, and there are usually ways to manage them.
Back to Paul for more on his prostate cancer journey.
When I was being offered the options, I think it was a radical prostatectomy, radiotherapy with hormone treatment and brachytherapy.
Which is another form of radiotherapy. After
they removed the prostate, every 3 months I went back for the test and my PSA was still rising. So I had to have radiotherapy along with the hormone treatment, which was a horrendous experience for me. I had to go to the hospital for 2 months, Monday to Friday, for the treatment, which was absolute hell for me. What it done to my body, my emotions, my mental well-being was, I wouldn't wish that on anyone.
And did you still carry all of that alone?
After my prostatectomy, I did tell my family that I had prostate cancer, and they weren't happy with me. We had lots of difficult conversations. I went through most of those treatments and journeys by myself, and they just wanted to be there for me to let me know I weren't alone. And I remember when I woke up in the hospital after my prostatectomy, and I was just in a room by myself, and I just started crying because it was so lonely. And waking up in hospital all alone, I was like, I should have told them.
What's the latest news with your health now?
I'm undetected and I have been since the radiotherapy and the hormone treatment. So I think it's 3 years now undetected. I now work in the cancer field because of my negative experiences. So no one has to go through what I went through.
Been so generous to share so much, but is there anything else that you'd like to share before we go?
I think it's our responsibility to make sure that we take care of ourselves. I think that we need to seek the right information. There's a lot of misinformation out there, and we need to do our due diligence and find the right information, what is accurate. And remember, I was eating well, I was drinking well, I was going to the gym, and I never had no symptoms.
Yeah.
And that could be you.
Thank you. Thank you so much to Paul for sharing your experience with us. And thank you, Dr. Matt, for those brilliant and helpful explanations. The symptoms of prostate cancer include needing to pee more often or urgently, difficulty peeing, or blood in the urine. If you have any symptoms that are ongoing, unexplained, or unusual for you, please speak to your GP. It is always better to get them checked out. For more information or support, call 0808 808 0000 or visit macmillan.org.uk. Now, before you go, if you found our conversation on prostate cancer insightful, helpful, or useful, please don't forget to hit the subscribe button. You can also like this video and share your thoughts or questions in the comments below. Thank you so much for watching.